Hello, and welcome to Digital Essentials, a course designed to help older adult caregivers and recipients of care navigate and understand the digital world. The course is presented by Senior Planet from AARP as a part of a CDC Foundation project. My name is Ilse, and I am a technology trainer here at Senior Planet. I'm very excited that you chose to take this course, and I hope you find this particular session helpful to you. This session is Your Health Online. It is part of a course that demonstrates how digital tools and platforms can help make everyday tasks easier and be used to improve physical and mental well-being. Today, I will be focusing on the growth of virtual visits, doctor's visits. I will walk you through one such visit. I will show you a short video, and then we will talk about online health resources. I will focus on Medline Plus, which is a website. I will also show you briefly the Mayo Clinic website. Then we will move on to ordering prescriptions online, and I will also share a new site called HowRightNow with you. And then we will end with helpful hints for you. So first, let's talk about the growth in virtual doctor's visits. As you can imagine, with the pandemic, people were hesitant to go to doctor's offices. They were asking us not to come to the office whenever it was possible for us to stay at home and have these visits with our doctors via video call. So we're about a year and a half into the pandemic, but at the beginning of the pandemic, the University of Michigan's national poll on healthy aging started collecting some information about these virtual visits. And the results of their poll was that 1 in 4 older Americans had a virtual visit in the first 3 months of the pandemic. And at about that time, 1 in 7 persons aged 15 and over said their provider offered virtual visits. And as I said, this was at the beginning of the pandemic. These numbers are now much higher. A lot more people are having these virtual doctor's visits. These video calls, they're very much like a call you would make on FaceTime and Zoom, and some healthcare providers do use those platforms for the virtual doctor's visits, but others use different kinds of software. They will all look very similar though, and I will show you a video. This is from the VA. This is one look of these virtual visits, and then I'll share my experience. So first, let's go to that video.
Meet with your VA care team over live video with VA Video Connect. VA Video Connect is easy to use with many convenient features. The picture-in-picture function allows veterans to see themselves and their providers at the same time. VA Video Connect supports multiple attendees, meaning that veterans can invite their caregivers or family to join. The participants box shows everyone in the appointment, and the chat box allows for typed conversation. With the touch of a button, veterans can mute their microphone, turn off their camera, end the appointment, and on mobile devices, flip the camera to allow providers to view wounds or other ailments. Talk to your VA care team today about using VA Video Connect.
So I said I would share my experience. When I was told that video calls were a possibility for me, I was told that I could use the portal that I already used with my account to schedule visits, but I also received instructions to download an app on my telephone that would give me access to my health information just as I had before on my computer. So on my app, I was able to make appointments and I was able to have that virtual visit with my doctor. What are some advantages of having these virtual doctor's visits? They save the health insurance, they save the clinic, the hospital a lot of money when we don't have to come in. And these may be saving us money too, because we don't have to arrange for transportation. We don't have to pay for gasoline to come to the office. Also, sometimes we're not well enough to go see the doctor, so we can have these these video calls from the comfort of our home. The downsides are that if you have to be seen because you have to be examined, these virtual calls are not going to be, they're not going to do it for us, right? We need to go into the office. Another downside is that these rely on our ability to be connected to the internet. If our Wi-Fi is down, we won't be able to have the visit. So just keep these drawbacks in mind, but these virtual visits are here to stay because the pandemic is not at its end yet. And in the future, these virtual visits will be beneficial to us even when the pandemic is over, for the reasons I've mentioned. One way to get yourself ready is to look up online the questions you have about your symptoms, about your condition, about drugs that may be prescribed to you. So now I'm going to go back to my slides, and we're going to look at these online resources. So we go on various websites to look up information to help us be better informed and ask our questions, the most relevant questions. So what online resources are there? There are many that are reputable. We will share with you two: Medline Plus and the Mayo Clinic website. So we go on these websites not to self-diagnose. That would not be a safe thing to do, but we go on these websites to read up on the topic and be better able to ask the questions that would be most helpful to us. Also, we may be learning about a condition or about the symptoms of a loved one, and then we will also be in a good position to better understand what's going on with them and better support them. We will also take a look at this new site, HowRightNow, and that's geared towards our mental and emotional health. So let's talk about Medline Plus before we go on the website. When we go on the website, we will not see these red borders, but here they're just highlighting some important information to us. The first thing to look at when we're on any website is, what is the source? Is this a reliable source? So with Medline Plus, we should feel pretty confident, if not completely confident, that this is a reliable source. This is from a governmental entity. It is administered by the US National Library of Medicine and the NIH, National Institutes of Health. Another important part of any site is that S in HTTPS. That is not a random letter. S stands for secure. That means that this website has cybersecurity measures in place to keep your information confidential and secure. The other red box is around the topics, and there are many topics on that website, but we will focus on health topics and drugs and supplements. I hope you will agree with us that this is an easy to use site, easy to navigate, and it offers several helpful tools. We will as I said, focus on health topics and drugs and supplements, but we also encourage you to explore videos and other tools such as questionnaires and tests, not tests to diagnose yourself, but tests about your knowledge about a certain topic. Okay, let's go to Medline Plus now. So the first thing to do when we look at any new site is to familiarize ourselves with the look, see if there is a search box. On most sites, you will see a search box either at the very top or maybe to the sides, but quite prominent, quite easy to see. So we can just go straight to that search box and type up any condition or any symptoms that we want to know more about. Or we can explore these topics here on the horizontal menu: health topics, drugs and supplements, genetics, medical tests, videos and tools. So as I said before, if you want to look something up, you can use that search box, or you can click on health topics. And let's say you're interested in learning more about hypertension. So you can type hypertension at the very top, or you can go to H and scroll down. I'm going to do it quickly. Hypertension. I am hovering over the word and nothing is happening there because there's no link. The link is the colored letters, so blue or red. So I can click on high blood pressure and scroll down. There's a lot of information there. And here in this box, you have all the topics. You can skip right to the topic you want to focus on. But my recommendation is keep scrolling down and look at all the topics and focus on those that are of interest to you. So what is blood pressure? How is high blood pressure diagnosed? So this is talking about how it's actually done, not how you will be diagnosed on the site. That does not happen. And you can take a look at those questions, see how thorough the information is. And down here you have articles that you can click on, and then let's see, suppose we want to click on this one. We will be sent to another site. Not to worry, you will be able to go back right away. You read this, and there's even a video there. You can read this article, and when you're done, there's no need to feel lost. You can just click on that tab at the top to close it, or you can just go back to where you were before. Just keep in mind that that's the Medline Plus icon. Just click there and you're right back on that site. What else can we do? Remember, I said we were going to focus on drugs and supplements. So let's click right there. And the same method applies. You can use the box, the search box, or that alphabetized menu. And let's look up Lipitor, so L. Okay, so again, I'm going to scroll down quickly to go to Lipitor. There it is. So notice that it does say Lipitor, so we can find it, but also it is, the link really is the generic name, atorvastatin. Okay, so let's click there. That's always hard for me to say. So atorvastatin, and we get a similar look, right? We get all the topics here that are covered under atorvastatin, and a notice. So here, if there are any warnings, any special precautions that we need to take, recommendations. So it's right there even before the topics start. Why is this medication prescribed? How should this medicine be used? So again, you can look at all this information and start formulating your own questions. What is it that I want to ask my doctor? And these should help you. Side effects. If you're concerned about any side effects, you can mention these to your doctor and then get your doctor's take on it. How to store it. A lot of information, right? This is quite a thorough site. So I'm going back up. And this is what I wanted to show you on Medline Plus. And we're going to go now to the Mayo Clinic, and you will see that the major features are quite similar. So I'm going to go straight to Mayo Clinic. Just to show you where to find the information. This is a clinic, it's a healthcare provider, and this site was created for patients. So you see on the right, you will be able to log in to your patient account. we're not all patients at the Mayo Clinic. So what we're going to focus on is health information right here, which is available to any of us. We don't have to be patients at the Mayo Clinic. We don't have to have an account, just like Medline Plus. So you have diseases and conditions, you have symptoms, as you would find on Medline Plus as well. So I'm going to click on diseases and just let's focus on hypertension again. I'm trying to find it, high blood pressure or hypertension right there. A major difference between this Mayo Clinic site and Medline Plus is that even if you click on any articles here, you're going to stay on the website. You're not going to be sent to a different website. It's maybe easier, but I hope you find that with Medline Plus, going back and forth out of the site to look up an article and going back in won't be a problem. So Mayo Clinic, very similar as well. And I encourage you to come here to the site and under health information, explore what they have here. So we've looked at conditions, we've looked at medications. What if we want to order medication online? Is it possible to do? So let's go back to our slides. Let's focus on ordering prescriptions online. A lot of people may be tempted to buy prescriptions from sites from abroad, other countries. Senior Planet feels that it's something that should be done with a lot of caution, because in other countries, there may not be the same kind of regulations that there are here in the US. These medications may be old, they may not be true to what they're supposed to contain. Maybe they're fake medication. It is possible. So the first thing to look at is this website a reputable one, a trustworthy site? One thing that you can look at is that seal at the very bottom of our screen there. It's the National Association of Boards of Pharmacy. It is not the only such accreditation agency. There are others, but that is an important one to look for if you are on a website where you can buy your prescriptions. We are going to go on goodprescription.com and PillPack.com. On both sites, you can order prescriptions. On Good Prescriptions, GoodRx.com. A lot of people go there not to order prescriptions, but to get discounts. And that's what it does and what it's best known for, although you can also order prescriptions there. So you can compare prices for prescription drugs. I will show you how, and you will be shown the lowest prices at pharmacies near you. Not to worry, you don't have to give your full address, just your zip code is enough for them to tell you what the nearest pharmacies are and what their prices are. Then you'll be able to get free coupons, and they also have a savings club and mail order options. I will tell you more about it. And then the other site that we're going to look at is PillPack, and it's all about ordering your prescriptions. I will tell you more about it when we get there, but it is suited for those taking 3 or more pills a day. The pills come prepackaged. We will see how it works, and they are delivered to us, to our door. And you can also invite a caregiver to share access to your account. Or if you are the caregiver, the person you care for will be able to add you to the account. So let's go to those sites. First, GoodRx.com. And as I mentioned before, there is that search box. That's the first thing we see. I've been on the site before and it knows where I am. I allow that for them to know where I am. So let's stick with Lipitor. Let's write Lipitor right there. And it says atorvastatin. Let's hit enter. Find the lowest prices. So before anything, it gives you information about that prescription. And notice that we can choose generic or the brand. If we can choose generic, that's absolutely the best, right? It's going to be less expensive. What kind of tablet is it? Here, I don't have another choice. It's there. I don't think there's a choice of gel or others. And here I have a choice of the dose. Let's see, let's just an example. If you do have to switch, you have that ability right there. Is it 30 tablets? Is it more? So maybe we want 45 tablets. And notice that we already have a list of where of the pharmacies, right? Where to find these medications and how much they will cost. So Safeway, there's one very close to my home. In 5 minutes, I can get there, or somebody can go get it for me. And that's how much it will cost, $9.45. So I will click on Get Free Coupon. And notice that it shows the pharmacy logo there. And I have an option to have this coupon sent to me via text. So I would give them my telephone number, give this website my telephone number. I can show you how it works. So you write your phone number right there, and you will get the coupon on your smartphone. Or email. If I don't mind sharing my email, I will write it right there. And then I will get the coupon via an email message, or I can print this right away. So if I'd rather not share my information, I can just print right here. And you see that you have the coupon, and you can also read up about how it works right there on that screen. So how do you use this coupon? You have to bring this coupon to the pharmacy along with your doctor's prescription. And they will honor that coupon. It cannot be used in combination with your benefits. So if you have Medicare, it works. You can absolutely use this coupon if you have insurance. If you don't have insurance, these are all contexts in which you will be able to use this coupon at the pharmacy. And remember, it has to be the pharmacy that has issued this coupon. Okay, so that is how it works on this site to find this coupon, find the best deal for you. They also have a program for you to, or a membership model for you to get these prescriptions delivered to you. Let me give you more information about how that works. It does require membership. The membership has a 30-day trial. The monthly membership costs $5.99 for individuals and $9.99 for the family plan that covers up to 6 members on one account. That includes friends, family, and pets. Now we're going to move on to PillPack. Let's go to that website. This is offered by Amazon Pharmacy. This is not the same as Amazon Pharmacy, but it is offered to us by Amazon Pharmacy. You don't need an Amazon Prime membership to use PillPack, but if you do have Amazon Prime, you may be able to get extra discounts. This is not really a discount site. What they provide is efficiency and convenience. So how does this work? To get started, you will have to provide your medical information information about who your doctor is, your insurance information, and it takes them about 2 weeks to process that paperwork. So you won't be receiving your first supply of medications until about 2 weeks after you get started. So once you do get started, they will have the list of medications that you take and how often and how much of each. And you will get, for each day, you will get a packet. That's why they're called PillPack. If you do have Amazon Prime, you'll be able to choose bottles rather than the packs. And you can get automatic refills, and you can get behind the scenes support, meaning you can text the pharmacy and ask questions or make requests. The service itself is free. The insurance company or the healthcare facility or both, they are going to pay for this. But as the patient, you do not pay for this service. And I want to show you at the very bottom that seal, that accreditation. So this site is NABP accredited. It's also accredited by URAC. We have been looking at information about our conditions, our symptoms. We have been looking at medication. Now let's look at our mental and emotional being. HowRightNow.org is a site from the CDC Foundation, our sponsor for this series. And it was created in partnership with the CDC, Centers for Disease Control. So we know this is a reputable site. This was created with our emotional and psychological well-being and a need for us to develop resiliency, because a lot of us have been affected in small ways, some in big ways, by COVID-19. There's stress, there's grief, there's loss, there's this maybe even anxiety about us being cooped up in our homes so much. So this site was created to help us get in touch with how we're feeling and then get help, either by reading the articles that are on the site or getting on the phone with people who can help. Let's go to the site and learn more about it. So this is the site, HowRightNow. You see the CDC logo right there. And we start with how are you feeling? Notice that there is need help right now. And that may be the case, and we will go there in a minute. But we always start with how are you feeling? If there isn't an emergency, we start with how are you feeling? And you may have experienced this, these greetings. How are you? Oh, I'm fine. But that's what we say because that's socially acceptable, but we may not be fine. And in those situations, this may be a good site to look at. Notice also at the bottom that there is an exit site button. This site is for all people with emotional needs. And if it is an emergency or a crisis, for example, people who are experiencing domestic violence, and if they're looking at the site and then the abusive person is approaching, that person looking at the site can click on exit site and it'll take that person to a blank Google search page. So you can see that that's a useful feature. For a lot of us, maybe we just don't want others to know that we are concerned about our own well-being and that we are anxious or that we are stressed out. In that case, that's also a good feature to have. If you want this to be private, you don't want other people to see what you're doing. That is totally fine, right? We do have the right to our privacy. So how are you feeling? And you scroll down and you have some emotional, mental states. And yeah, let's see, maybe it's stressed. Maybe you have extended caregiving. obligations, and it's been hard for you. So notice that this is a feature resource. It's an option. You can click right there. If you keep going, there are other resources from the CDC, from NAMI, which is a mental health organization, mental health promoting organization, veterans. So you see the wealth, AARP, you see the wealth of information that is available to you, and you can click on any of these tips for elders and their caregivers, managing stress. So a lot of information there for you. And that's all, those are all choices that you can have. So I want to go back to where we were to take a look at the other options here on this site. So let's go back up. I mentioned help. Do you need help right now? So you can scroll down and see what situation applies to your case. You see domestic violence there. You can call someone, trans life, LGBTQ, veteran support. There's also elder care, the elder locator, Alzheimer's Association helpline. So lots and lots of resources. I'm going to go back and keep scrolling down because there's more. There's more for us on this site. So there's the check-in, how are you feeling? And then resources to help you with those feelings. Start a conversation. So here you have videos of people telling you about their experience in articles about how to start a conversation. It's not always easy to talk about these challenging topics. So here are suggestions of how to best have conversations about these challenging topics. Here, looking for inspiration. This is video-based. There's a lot of information about people who have been through similar experiences telling you how it went for them and how they coped. And there's about resources. So all kinds of resources available to us. We can see all resources just to give you a few, an idea of a few of these topics, how to talk about mental health, coping with loss, how to build resilience from the stress of the coronavirus. Again, a tremendous amount of information. And back where we were. And here is information about the campaign, how it came to be. It is designed to promote and strengthen the emotional well-being and resiliency of populations adversely affected by COVID. And we are back to need help right now. And that is the site. So to summarize, these are all resources for us to be better informed and to better cope with the difficult situation we're all in this time of pandemic. Let's go back to virtual visits, which was our starting point. You are entitled to know more about the safety precautions, the cybersecurity measures that are in place to make sure that your health information is kept confidential and secure. So feel free to ask your doctor. If your doctor doesn't know what these measures are, you can always call customer service. They will direct you to the people who know the answers to your questions. So how is it that my information is being kept secure and confidential? And when you go online to look up anything, always make sure you're getting your information from a trusted app or a trusted site. A trusted app would be an app that's recommended to you by your doctor or your healthcare provider. A reputable site is one that has that S, it has the cybersecurity measures in place, and also one that's from maybe an organization, a nonprofit organization, or so that would be the .org type of site, or a government agency, so that would be the .gov type of site. Even if it is a commercial site like Good Prescriptions, it's .com, but still it has that seal of approval from several accreditation agencies. As we mentioned, always use the HTTPS sites, especially if you're giving your email address. If you're buying something and you're using your credit card, always make sure you are on an HTTPS site. And finally, for online pharmacies, look for the NABP seal. And if you don't see one, are there other seals of approval like the BBB, Better Business Bureau? Thank you for joining us for this session of the Digital Essentials course. And remember, this is only one session of the course. There are other sessions. And to find out where the other videos are, go to seniorplanet.org/caregiving. You will also be able to access handouts, instructional videos, and additional information.